Hello and welcome to this episode of Recitals. This is October and we'll be discussing social issues. The themes we are covering today will be livelihoods, health and child rights. Let's discuss addressing hunger and malnutrition in India. Recently, the Global Hunger Index 2024 was released, and let us see where India stands in terms of the position we are in, how is GHI calculated, how is it impacting the country, what have been the various aspects of it. Let's just discuss that. Now, first thing, the Global Hunger Index is an annual publication that is published by the US-based International Food Policy Research Institute called IFPRI and German-based Welter Junge Hilfe. And then we also have an Irish NGO called Concern Worldwide. So these are the three which are involved in it. And only in 2007, a worldwide Concern Worldwide has joined this publication. And in 2018, what happened was IFPRI, that is the International Food Policy Research Institute, withdrew from the project. So they are no longer a part of it. Till 2017, they were a part of it. They are no longer a part of it. And GHI became a joint project of Welter Junge Hilfe and Concern Worldwide. So right now, the Global Hunger Index is a publication that's released by the Germany-based Welter Junge Hilfe and the Irish-based Concern Worldwide. Now, this time there was a theme. Like every year, we have a theme for the global GHI, and this time the theme was how gender justice can advance climate resilience and zero hunger. So, what are the various statistics of GHI? Let us take a look at that. Now, the current score, this is the global score, is 18.3. We'll also discuss how these scores are measured. 0 is absolutely no hunger. This is actually based on a scale from 0 to 100, and 0 is no hunger, and 100 everybody is hungry, or rather everybody is starving to death. So every country, even the world as such, is placed somewhere on this scale. Now coming to the global score right now is 18.3, which shows a slight improvement from 2016 score of 18.8. It's a very minor improvement. Now there are about 2.8 billion people who cannot afford a healthy diet. These are the vulnerable populations around the world, and the impact of climate has been such that more and more people are going to be affected by this. Now, how is it in terms of regions? Let us see. The highest rates of malnutrition and child mortality globally are in sub-Saharan Africa. So sub-Saharan Africa is very simple. You have the Sahara somewhere here. If you think of this as Africa, anything below Sahara is called sub-Saharan Africa, which is basically, other than a small group of countries here at the top of Africa, everything is sub-Saharan Africa. Now coming to South Asia, countries like Afghanistan, India and Pakistan are facing substantial challenges, substantial hunger challenges, and India has a unique problem. India, we have a strange problem of obesity and malnutrition. So basically what has happened is, over the past few years as a country, we have made enormous progress, say the past 20-30 years. But the progress and the development has not been spread out evenly, resulting in certain populations which are becoming obese, which are exposed to unhealthy diets because they can afford it, and certain populations which are not able to get even the basic calorific requirements that are necessary. So this is a unique problem. It's considered the population paradox or the developmental paradox of India, and this is an idea that will recur in several other topics. Now, what are the difficulties? Now, SDG 2, that is the Sustainable Developmental Goals. We have the Sustainable Developmental Goals set across the world to be achieved by the year 2030, and SDG 2 is zero hunger. And GHI 24 is saying that 42 countries face alarmingly serious hunger levels, making the possibility, marking a stagnation to fight against hunger despite progress, which is to say 42 countries in the world are actually not making progress in terms of eliminating hunger. And there is also the other issue of gender disparity. Around the world, what's happening is, because of the patriarchal societies we live in, women are the last people who are considered to be given food. And also there are questions of conflict, there are questions of violence. Because of all that, what happens is, in most of the cases, when families are deprived of food, or rather their calorific requirements are not being met, women as such get even less food. So this is a problem that occurs across the world, and including our own country. Now, there are a few ideas which are central to the idea of fighting against starvation, fighting against hunger. Over a period of time, say from 1948, the United Nations, through several of its organizations, several of its arms, has actually come out with specific ideas. These ideas form the core of our fight against hunger, and most of the countries are signatories to these ideas. So these are the three ideas which are actually the reason many countries are actually bound to take care of the hungry population. So the basic idea is right to adequate food is realized when every man, woman and child, alone or in the community, have physical and economic access at all times for adequate food or means for its procurement. This is the idea that has been accepted by everybody. This is UNHCR in 1999, and this idea that every man, woman and child must have either access to food or the means to procure it. This is the central idea in our fight against hunger, and the world has actually agreed upon this. Now the other thing is, there are three principles. The first is the respect principles. States must not interfere in the right to enjoyment to food, or rather the right to food. No state must interfere in the right to procure food of any individual in that state. That's the first principle. The second one is the protection principle. Governments must ensure that actions of third parties such as private actors do not violate the human right to food. It can't be that private parties are allowed to take over, say, farmlands, because of which everybody starves in a country. That is not allowed. Now, the third is the fulfillment principle. States must facilitate the right to food by strengthening people's access to and utilization of food resources. Now, right to food is also a central idea in our own legal positions, in our own constitution, and we even have right to work, which is a corollary of that. So these are the three principles that we must be aware of when we talk of global hunger, starvation, or the right to food. We talk of the respect principle, the protection principle, and the fulfillment principle. Now, how is the global hunger index calculated? It's based on three aspects, or rather actually four aspects. First is undernourishment, child stunting, child wasting, and child mortality. So how do we calculate this? Now, in undernourishment, we measure the inadequate food access, and is an important indicator to hunger. If people are not getting food to eat, it inevitably means that they are going hungry. Now, this is used as a lead indicator for hunger reduction targets. So this forms 1/3 of the scale. The second is child stunting and child wasting. When you have undernourishment, it manifests itself in terms of the children not going tall enough and not putting on enough weight. So we have standardized measurements, what we call the body index measurements, and when a child of a particular age is supposed to be of a certain height and a certain weight. So when either of these don't happen, we know that there is undernourishment to the point that their own growth is being affected. Now the third is child mortality. Child mortality reflects the most serious aspect of hunger, because when children are the most vulnerable when populations are going hungry, and if child mortality rates are very high, clearly shows that people are not getting food. Now, how do we calculate this further? Undernourishment is given 1/3. The statistics for this come from the UN Food Organization and from the United Nations Food and Agriculture Organization. Then we have child stunting, which is given 1/6, and child wasting, which is also 1/6, because this is again 1/3, right? So UNICEF, WHO, and World Bank, Demographic Health Service, these programs contribute the statistics to this. And child mortality is given by the UN Interagency Group for Child Mortality Estimation. So together, these four aspects, or rather 1 plus 1 plus 1, it's actually, you can call them, these two, we take them together. So these three together give us a GHI score. Now, on the GHI score, if it is below 9.9, it's considered low, and that is where every country should be. Moderate would be 10.0 to 19.9, serious is 20.0 to 34.9, and alarming is 35.0 to 49.9, and extremely alarming is over 50. Now, India is somewhere here actually, we'll come to this, remember this scale, and India is somewhere here. We were earlier, and we'll also see how other countries in the world are in comparison to us. Now, how is it happening? Hunger is still considered alarming in 36 countries, sorry. In 36 countries, it's alarming in 6 countries and serious in 36 countries. And remember, climate change is actually going to make this worse, because there are at least 23 countries which are at risk of extreme serious climate, and the largest country at the risk of extreme serious climate change is Pakistan. Now, 22 countries are in the moderate to serious or alarming GHI scores, and their hunger GHI score has actually increased. 20 countries are in moderate or alarming, their progress has largely stalled. 5 countries are in moderate or alarming area, and these 5 are Fiji, Jordan, Libya, Syria, and Venezuela. And at least 64 countries will not reach low hunger, much less zero hunger by 2030. So this is what is the more important aspect of more important finding, that at least 64 countries, we know for certain, they are not reaching zero hunger by 2030. Notable progress has been made by Bangladesh, Mozambique, Nepal, Somalia, and Togo. Now, this is important, that Bangladesh and Nepal are our neighbors, and they're doing actually better than us despite having fewer resources. Now, what are the causes for hunger? Why is this happening across the world? Primary cause, right now, one of the important causes is climate change and environmental degradation, because of which there is a loss of land. The quality of land has been lost. Because of this, the agricultural output has been affected. Now, there are armed conflicts. Now, armed conflicts are an important reason when we are talking of hunger and starvation, because whenever we have armed conflicts, large sections of the population actually go hungry. You must be seeing news about what's happening in Gaza, what's happening probably in Ukraine, it's being hidden. But for example, armed conflicts anywhere in Africa, for example, in Sudan or any other parts of this, any other part of the world, for example, in Gaza, you are seeing almost 100% of the population is actually, according to the UN, is close to starvation. 100% of the population has become poor. So armed conflicts have an extremely severe impact on hunger. Other thing is, there are success stories. Lower income countries struggle with debt. That is another reason why this happens, because of which funds are diverted away from critical developmental needs. This is another reason that happens. Now, there are success stories amidst the crisis. Countries like Mozambique and Nepal, like we just said, have achieved significant improvements in their targets, in their scores since 2016. And then there is a call to action. GHI is saying that there is a worldwide, everybody should come together in the world, should come work to actually reducing hunger. Now, what is the case in India? What are the India specific findings? Let us see that. Alarmingly, we have high levels of child undernutrition. What we are seeing is that close to 35.5% of children under the age of 5 are stunted, indicating chronic undernourishment, which is a very, very big figure. 35% of the next generation is stunted. They're not going to reach their potential, the heights and weights they're supposed to reach. Now, this is this also affects children's physical and cognitive growth. It's not just the physical aspect that's there. Then further, 13.7% of the overall population, it's not just children, but overall population suffers from significant undernourishment. Now, child mortality rates, India has brought it down to 2.9%. What about our rank? Where do we stand? We are ranked 105, which is very, very, very low as a country that is for a country that's basically sending spacecrafts to Mars. We ranked 105th out of 27. Earlier we were 111th, but we have improved, but not to the extent that we'd want to. Now, India's wasting rate is at 18.7%. Like I said, child stunting is at 35.5%. Undernourishment is 13.7%. And child mortality is 2.9%. Now, we also have a portion tracker which is used by the government, and we actually actively have data of how much nutrition is being given to children across the country on a daily basis. Now, the portion tracker measures 8.5 crore children in 0 to 6 age cohort, and they're also saying that 35% child wasting. According to portion tracker, it is 35%. And underweight is, according to portion tracker, it is 17% children are underweight, and 6% are wasted. Wasting, 6% suffer from wasting, which is like their bodies are being wasted. Now, India's GHI score is 27.3. This is the most significant thing that we have to remember. This is our GHI score, which actually puts us in the serious category. We are in the serious category, in terms of global hunger index. Now, this is a slight improvement from 2016 when we were at 29.3%, and this is still related to, say, in 2000 our score was 38.4%, 38.4, one can say percent, and in 2008 it was 35.2. 2024 we are at 27.3. So these are the figures for India in terms of our GHI, where we are in the 0 to 100 scale. 2000 we were 38.4, 2008 we were 35.2, 2024 we are 27.3, which is still very high considering the kind of development that's happening around the country, which is still quite high. Now, there is, strictly speaking, in a decade, our performance has been minimal. We have just moved from 29.3 to 27.3 in about just under 10 years, which is not much. Although there have been significant gains, a lot of issues continue to persist. Now, compared to us, compared to our neighbors, how are we doing? Sri Lanka, Nepal and Bangladesh, each of which has fewer resources, actually is performing better than us. Then there need to be comprehensive solutions. The government is also actually doing a lot, and what we can do about this is we should have food security should be central to all our policy making. Healthcare access, again, the government is actually doing a lot on this. We have discussed several programs of the government in many previous episodes about how the government is addressing the healthcare needs of the country. Then we also have maternal and child nutrition programs. The government also is running programs on this, and some of the initiatives in India are like National Food Security Act. We also have a PM Poshan scheme. We also have the PM Dhanjan Yojana. We have several schemes actually. All of these are aimed at this. Now, how are the GHI scores in Southeast and Southeast Asia. If you see that, India, like I said, is at 27.3, sorry, and Pakistan is at 27.9. Not much of a difference between India and Pakistan in terms of scores. And if you actually see, Nepal is at 14.7, considering they hardly have any resources. They're a landlocked mountainous country without access to any port. The only port access they have is through us. Still, they have only 14.7. And look at Sri Lanka, they're at 11.3. They've just come out of a massive conflict, and their fewer of their children and population is hungry than ours. Then we look at China. China has actually made the most significant progress in the past several decades, and they brought down their GHS score to less than 5, which is almost there at zero hunger. Now, from 2021 onwards, the government has actually been questioning the methodology used, because one of the problems with these surveys is they're surveys, and the survey has a sample. The sample size is generally about 3,000, which is inadequate, whereas the government says we have 8.5 crore people for whom we have actual data. So the government used to say that our data is more accurate. Surprisingly, this time the government has not come out with a rebuttal. What the Global Hunger Index has done is they have a FAQ based only for India. They've answered some of the questions raised by our government, and because of which probably the government is yet to come out with a response for this. Now, like I said, the portion tracker has measured 8.5 crore children in the 0 to 6 age, which actually some of the, like I just showed you, some of the percentages do match. So we have raised several issues based on the methodology, and even some of the other issues we have raised have been about how different genetic compositions of different populations and different dietary habits result in different growth patterns. So Indians may have a growth spurt later, so the height requirement might be different, or maybe the actual total average height of the Indian population is lower. So this is one of the issues we have raised, and they've answered these issues this time. Now, let us look at some of the previous year's papers, what kind of questions have been asked in issues related to this. There was a question in 2018 in the mains, and the question in the mains paper, and the question was, how far do you agree with the view that the focus on lack of availability of food as the main cause of hunger takes the attention away from ineffective human development policies in India? So this was one question, and everything we have discussed today could go into part of it. Now, there was a PCS civil service examination. This was a prelims exam. Which of the following is or the indicators used by IFPRI to compute the global health index report? Remember, IFPRI was with GHI only till 2017. After that, they have separated from them, and now it's not run by them anymore. It's only Welterhungerhilfe and Concern Worldwide. And which of the following is indicators used by IFPRI to compute the GHI report? Undernourishment, child stunting, child mortality. The right answer is all the three. Let's discuss pandemic fund to curb zoonotic diseases. Now, the Union government, more specifically the Ministry of Fisheries, Animal Husbandry and Dairying, launched the pandemic fund recently to address a very important issue of zoonotic diseases. This is part of the G20, it's actually G20 fund. Let's discuss it and see what it is, what is being done, and why it's important. Now, this is an initiative by the Ministry of Fisheries, Animal Husbandry and Dairying. They launched the pandemic fund project on animal health security. Okay. Now, this is a $25 million initiative, and it's funded by the G20 Pandemic Fund. So there are two things here. One, we have the Pandemic Fund project, and then there is a Pandemic Fund, and we have the G20 Pandemic Fund. So there are two things here. Okay. Now, as part of this, the Union Minister also released standard veterinary treatment guidelines outlining the best practices for taking care of livestock across the country. Then there is also a crisis management plan for animal diseases. It will provide a framework for taking care of outbreaks of animal diseases to ensure rapid containment. Remember that the recent coronavirus actually came from animals to human beings, and there are actually a lot of diseases that actually come from animals to human. We will also discuss all this. So this is just a background into that. Now, pandemic fund is being implemented with the Asian Development Bank, the World Bank, the FAO. Together, this is being implemented together with these three organizations. So it's going to require a lot of coordination between these organizations. The fund supports the existing initiatives of the department through enhancing disease surveillance. It's also aimed at, now what it actually aims at is human capacity building, enhance the skills of the people and capabilities of people in animal health, human resources. So this is what we are trying to. Now, what the fund will do actually is enhance disease surveillance. Now, one of the things that happened around the world was everybody was caught unawares. We didn't know that such a massive pandemic could break down because we were not paying attention largely. So, first thing we want to do is enhance disease surveillance, build laboratories. There has to be laboratory infrastructure, promote cross-border cooperation. It could have been contained actually in one particular country maybe. Now, India, there is also something called Global Health Security Index, which was again launched post-corona, and India has a low risk of 42.8. It has high environmental risks and a low score. We want to improve this because our preparation is not in tune with our needs. Now, the project will also, like I said, focus on human capacity building, improving data management systems, and enhancing disaster management frameworks. Now, the disaster management, like most in our country, the disaster response teams have largely dealt with natural disasters. We were not really equipped either in terms of our processes, in terms of our mindset, in terms of our policies for actually dealing with a pandemic. Pandemics were things that happened in the 15th century or maybe the early 20th century when you had the Spanish influenza or you had bubonic plagues. The world thought we have gone past that. But coronavirus or the corona pandemic has exposed how ill prepared we are, and has actually woken up the world to the reality that there can be severe outbreaks. Now, the fact is, as we destroy more and more forests around the world, many animal populations, many diseases that were hidden can actually cross over into human beings. Many times it's happening, especially recently it happened in Tanzania, that diseases have jumped from one animal to another and have crossed over into human beings. Now, similarly, as the ice caps are melting, new diseases might be released, new viruses might be released. So, the world was ill prepared for this. Scientists were warning about this, but now this is the policy response from across the world. Now, what are zoonotic diseases? We have been saying zoonotic. The idea is very simple. Any disease that comes from animals to human beings, where the reservoir of the disease is in animals and it can cross over into human beings, it's called a zoonotic disease. Remember zoonotic disease. They're transmitted between animals and human beings, and these can result from various pathogens like viruses, bacteria, parasites, and even fungi. Now, what is an endemic disease? When a disease enters the endemic stage, we say that a substantial part of the population has become immune to it, either because they contracted and recovered or they have been vaccinated against it. Now, what is an antibody? An antibody is an immunoglobulin, that is a large Y-shaped protein belonging to the immunoglobulin subfamily, which is used by the immune system of the body to identify and fight diseases. So, these are the ideas we should keep in mind when we talk of this topic. Now, What is the Global Health Security Index, on which I said that our score is about 42.3? It's basically a comprehensive assessment and benchmarking tool. Evaluates the preparedness and capabilities of countries to prevent, detect, and respond to global health outbreaks such as pandemics and other such epidemics, and other such problems, other such serious threats. It was launched in 2019 by the Nuclear Threat Initiative, and at the John Hopkins Center for Health Security. These are the three, and the Economist Intelligence Unit. So this was launched in 2019, and these are the organizations involved in it: National Nuclear Threat Initiative, John Hopkins Center for Health Security, and the Economist Intelligence Unit. So please remember, this is the kind of thing that ends up in prelims. Now, the index, what it does is it assesses countries based on 6 key categories. One is prevention. What are the measures to prevent the emergence of pathogens? What measures are being taken by the country to actually prevent? The second is detection reporting. In case there is a pandemic that has emerged, in case there is a zoonotic disease that has emerged, how is the detection and reporting in that country? Now, what is the third is rapid response, the ability to quickly respond to an epidemic. The fourth is health systems. Now, when Corona happened, we saw that the world was overwhelmed by the disease, and practically no healthcare system anywhere in the world was able to take care of people. You saw people being treated on the streets, sometimes dying in the streets. And we also saw some very good responses by governments. Quickly field hospitals were set up, stadiums were turned into hospitals. So all that would be part of the health system. In the face of an epidemic, how good are your current systems, and how quickly can you scale up if things go bad? So that would be the fourth criteria. Then there is compliance and with international norms, adherence to global health regulations. The sixth is risk environment, broader socio-political and environmental factors affecting health security. So these are the 6 key areas on which countries are basically being assessed, and that is how the score of 42.3 has been reached by India. I mean, that's how the score of 42.3 has been assigned to India. Now, the global health security, basically, like I said, it's about prevention, detection, and reporting, rapid response, health systems, how they are, compliance with international norms, and risk environment. Now, why do we need this? Why do we need this whole system of things in place? Why do we need so many systems? Why do we need so many policies? The reasons are, India faces significant challenges from zoonotic diseases. Rabies is a zoonotic disease. Leptospirosis is an avian influenza. These are all already happening across the country. It's not that only Corona was a zoonotic disease. There are several other similar diseases. Now, there is also a problem of antimicrobial resistance because of the overuse of antibiotics. Lot of antimicrobial resistance has built up in the country. This is another thing the government has been trying to address, and there are several policies in place. There is also what is called the Chennai Declaration, where people are now trying to reduce the kind of and the amount of antibiotics that are being used. We have discussed this in one of our previous episodes. Please take a look at that. Now, One Health approaches are crucial to reducing AMR by promoting responsible antibiotic use. This is one reason. Now, the other thing is livestock and agriculture. India has a very large number of about 536 million livestock across the country, which means that we have a large pool of animals from which zoonotic diseases can happen. Now, what are the common zoonotic diseases? COVID-19. All of you are familiar with that. There is rabies, avian influenza, Ebola, which is an extremely dangerous and deadly virus, and there have been several outbreaks of it. The fatality rates are very, very high with Ebola. Then we have Salmonella, which is a very simple thing. People have bad food and then you have food poisoning. So these things are already happening, like I said. What are the transmission methods for zoonotic diseases? There's direct contact, indirect contact, there could be vector-borne, there could be food-borne, or there could be airborne, like Corona was airborne. Now, like I said, India has 536 million livestock, including cattle, buffalo, sheep, goats, and pigs. And this is the second, and we also have the world's second largest poultry market in the world. We also have an exceedingly, we have a robust actually fish culture in the country where we actually grow a lot of fish. That leads to salmonella poisoning. So this is the reason we actually need this, why we need to be a part of this, why we need to do this. So what are the key objectives of the G20 Pandemic Fund? Strengthen global health security, address zoonotic risk, support low and middle income countries, and the funding initially was supposed to be 1.4 billion, and the fund mobilizes grants and low interest loans for eligible countries. Now, what are the government initiatives in order to handle this problem? What the government has actually several programs in place. We have the National Animal Disease Control Program. It's a flagship scheme launched in 2019 for control of foot and mouth disease by vaccinating 100% of the cattle. So basically, foot and mouth disease is a pretty serious thing that affects cows mostly, and also affects some of the other. It affects buffalo, sheep, goat, and pig population, but we generally see it a lot in cows because we are more exposed to cows, and it's a very serious disease, and we have now tried to vaccinate practically the entire cattle population in the country. Now, the other thing is we have the National Livestock Mission launched by the Ministry of Agriculture. It aims at ensuring sustainable practice of livestock sector, including dairy farming, focuses on increasing the productivity and improving their health. If you have healthy cattle, then the chances of actually pandemics emerging from them reduce. Now, we also have the National Action Plan on Antimicrobial Resistance. This was launched in 2017, but this largely addresses human health but also covers animal health. Then we have the National Center for Disease Control, and we also have the Integrated Disease Surveillance Program. So these are some of the projects and the policies and programs that have been launched by the government for addressing this problem. So to summarize, basically we have launched a $25 million G20 Pandemic Fund. The Union Ministry of Animal Husbandry, Dairy, and basically it's been launched by the central government. So $25 million pandemic fund has been launched. Now, this is a collaborative effort between Asian Development Bank, FAO, and is expected to be fully utilized. Now, the more important thing is this is supposed to be utilized by August 2026. It's just for 2 years. We want to use this and put everything in place to prevent another occurrence like that, like the one we have had in the past. We have a low score. We want to improve this by improving our policies and our systems, put systems in place. And the project actually will focus on human capacity building, will improving about data collection systems and livestock sector. So this is a comprehensive approach that has been put in place by the government and is being funded by the central government. Let's discuss child betrothals are a ploy to evade punishment, the Supreme Court has said. The Supreme Court recently came out with a judgment basically addressing a very serious issue that's happening across the country of child betrothals. Now, we have a historical problem that has been there for a very long time of child marriage in the country, and this problem is there across the world, not just us. Now, as the country has developed, we have changed our marriageable age. Right now, it's 18 for girls and 21 for boys. However, Himachal Pradesh has said that they want to make it 21 for both boys and girls. That's awaiting the assent of the president. Now, the Supreme Court recently came out with this judgment where they've issued directives to the center as well. Let us find out about this and what are child betrothals, why it's such a severe problem. Let's get into the details. Now, what recently this happened is the Supreme Court said that child betrothals are being used as a clever ploy to duck the punishment under the Prohibition of Child Marriage Act. However, it violates the basic rights of free choice, autonomy, and childhood. So, this is what the Supreme Court is saying. Now, what is happening is, because parents are not allowed to marry off their children under the age of 18, under the age of 21, they're coming into betrothals where families come together and say these two will get married later on, and that's a settled affair. This still means that effectively they are married in a certain way, and the courts are saying that there were several petitions in front of the court, and the court has said that this can't be allowed and there has to be a change to the legal system. Now, this is basically a marriage agreement is made between families often before they reach the age of legal age, which is to say that we don't take their consent into account at all, and parents just make the decisions for children. This does not involve an immediate marriage, but it sets a stage for formal marriage when the children reach a certain age. So, like I said, that is where the problem is. While the actual marriage might happen later, for all purposes, you may say the marriage is a settled deed. Now, the Supreme Court is saying that can't be done anymore. Now, legally, what is happening is they do not carry the same weight as a marriage, because of which they're viewed as agreements and they're falling outside the purview of the law right now. However, Prohibition of the Child Marriage Act aims to prevent marriages for setting the legal age at 18 for girls and 21 for boys. Now, engage in child marriages or even betrothals is seen as a violation of the law. I mean, it's violating the spirit of the law, but not the letter of the law. That's where the problem is. Now, there was this 3-member bench headed by the Honorable Chief Justice Chandrachud D.Y. Chandrachud Singh, and he said that this is basically a problem and has to be addressed. Now, what the Supreme Court said is, it has asked the Parliament to explicitly outlaw this practice. What the Supreme Court has said is, right now, outlaw child betrothals, and to classify the same thing, that children who are being put into this situation should be brought under the care under the Juvenile Justice Act. So basically what the Supreme Court has said is, make a change to the law, and any child who's been betrothed as a underage child who's betrothed should be brought under the Juvenile Justice Act. Let them be be declared as they should be put under minors in need of care. So basically you'll be taking them away from parents and handing them over to the state. That's the idea. Court also drew attention to how child marriages not only affected girls but also the young boys, reinforcing patriarchal norms and denying children of both sexes their right to childhood. Now, right to childhood is an important idea. When a child is married off, you're no longer a child. So the parents are taking away the childhood from the children. So right to childhood is being denied to children. This is what the Supreme Court said. There are some measures the Supreme Court has suggested: age-appropriate sex education, compensation scheme for girls opting out of child marriages. Suppose some child has been betrothed, somebody wants to opt out, there should be a way to help them. And a campaign to create child marriage-free villages involving local leaders. So this is what the Supreme Court has suggested. Now, there were a series of petitions, and over a period of time, because of which this has been done. Now, let us look at what are the child marriage statistics in India and how serious a problem this is. Now, if you will see, 1 in 5 according to Lancet Global Health in December 2023, 1 in 5 girls and 1 in 6 boys is still being married off before the age of 18 and before the age of 21. Now, across the country, in 1993, 49.3% of girls were being married off before the age of 18. Now, in 2021, it has come down to 22.3%. Come down to 22.3%. But if you look at it, more than 1 in 5 girls is being married off before the age of 18, which is still a pretty serious problem. Now, in the case of boys, it has declined from 7.1% for the same period to 2.2%, which should be zero. That's what we want it to be as a country. Now, all the states, the data has been used from National Health Service, NFHS service from all the way up to 2021 to compile this study. So, it's basically our own data. Now, the head count of child marriage in girls was quite high. All the states except Manipur have experienced a decline in the prevalence of girl child marriages across the country for this period, 1993 to 2021. Now, 4 states, Bihar, West Bengal, Uttar Pradesh and Maharashtra, accounted for more than half the child marriages in the country. So, there's 4 states. Bihar has about 16.7% of the girls there are getting married before the age of 18. West Bengal, it's 15.2%. Uttar Pradesh, it's 12.5%. Maharashtra, it is 8.2%. But together, these 4 account for about more than 50% of the total child marriages in the country. Jharkhand has the highest percentage in terms of increase in headcount in terms of child marriages between 1993 and 2021. Now, according to UNICEF, 12 million girls across the world are getting married before the age of, being married while they are still children. Now, this is also covered under SDG, Sustainable Developmental Goal number 5. So, this is one more thing, and this is where it is right now. Now, let us look at the previous year questions on this issue. 2010, there was a prelims question with reference to the United Nations Convention on Rights of Children. Consider the following: the right to development, right to expression, right to recreation. Which of these are the rights of children? All these 3. All the 3 are actually rights of children. Besides that, there was one more question. Empowering women is the key to control the population growth. Discuss. This was in mains 2019. So, these are 2 questions that have appeared on a related area, and this is where it is right now. Now, let us discuss impact of climate change on farmers in India. There was a FAO report. Let us discuss that. There was a recent report by the Food and Agricultural Organization which highlighted the vulnerability of the farmers in India and how they are actually going to be affected by climate change. Now, what the FOA report is saying is climate change disproportionately affects poorer farmers. I mean, this is kind of an established fact, but we are reinforcing it through statistical methods. Now, the report was titled The Unjust Climate, Measuring the Impacts of Climate Change on Rural Poor, Women and Youth. Now, the report basically said that what are the highlights? Income disparities. Report finds that poorer households globally will lose 5% of their income, which is quite a lot actually, due to heat stress, and 4.4% due to floods compared to the wealthier households. So, when there's a possibility that wealthier households will actually increase their incomes. I mean, even we as a country were targeting doubling farmers' incomes. But climate change actually means that they may actually lose their current income levels even. Now, in India, they are particularly vulnerable because of the climate sensitive agricultural practices. Remember, our agriculture is largely dependent on the monsoon. So, if climate patterns change, monsoon patterns change, that sounds disaster for the country. And we have already seen this, where we are saying that even though if the average of rainfall looks to be the same, we clearly see that some areas have had very heavy rainfall, we have had floods in some areas, In some areas, we are seeing droughts. And if you go into micro level mapping, you will see that actually rainfall patterns have changed a lot because of climate change, and they're already having a severe impact. Even if statistically the country is getting the same number of water days, same amount of rainfall as every year, the distribution of rainfall has changed a lot. What are the main findings of the study, the FAO study? Now, income loss from heat and floods, like I said, average of 5% of their income annually poor people will lose, 4.5% due to floods, 5% due to heat. Structural inequalities are a problem. Structural inequalities make poorer households vulnerable to climate stresses, which makes it worse for them. There's an effect on farm rural income. Now, one of the things that happens is that non-farm activities that support agricultural practices also get affected. Say, if there isn't enough water, how are you going to take care of your cattle? How will you have maybe a few cows that are actually supporting your income? You'll not be able to do that. Now, droughts and similar events are again a problem. There's a reduced total income of the population. Overall incomes will reduce compared to others. So these are some of the main findings. There are also the problem of structural inequalities. There is poor farmers dedicate more resources, and they also have to spend more time actually in agriculture, which means that education will be affected. Then also the other aspects of family are affected. Their health will be affected. Parents will not be able to take care of the children, because once you have reduced food coming into the family, that again sets off another cycle of poverty there. Now, dependency of the poor on off income increases, off farm incomes will decrease by 33%. Like I said, if you have maybe a few pigs or a few cows or a few goat, you'll not be able to keep them if there isn't enough feed for them, because there are no rains. So the farmers, where they'll be able to support their own income, that is going to be affected quite severely. Approximately, the gap will increase by 21 billion per year, while heat stress contributes to a gap of over 20 billion per year. Now, what are the policy recommendations that have been made to address this problem? Social security nets for vulnerable communities, anticipatory social protection programs. Now we know that climate change is happening and it is going to impact. We can't start programs after the event has started. We can actually start off now. So anticipate the problem and have a social protection policy in place. Then address gendered barriers in employment, promoting workforce diversification, and providing mentorship programs. Need to empower women and youth, gender transformative approaches. Then they also said have mentorship programs. So these are some of the policy recommendations that have been made. Now there has been a response by the NITI Aayog, and these are the responses by the NITI Aayog. We have started the national innovation on climate resilient agriculture, offering solutions for various crops, ensuring that farmers are equipped to address adverse climatic events. We have employment guarantee schemes across the country. In fact, Manrega was the first in the world. India was the first country to have Manrega. Basically, we had the employment guarantee for the entire population. During COVID-19, government distributed free food grains, Pradhan Mantri Kalyan Anna Yojana, for 2/3 of the population. We have already done this. Then the other thing is increasing women's participation. The periodic labor force surveys have shown that there is a significant increase in the population of women's participation in the workforce, showing that probably we are moving towards gender equality. Now, let us look at the previous year questions. The FAO accords the status of globally important agricultural heritage system to traditional agricultural systems. What is the overall goal of this initiative? To provide modern technology training in modern farming methods and financial support to local communities of identified GIHS so as to greatly enhance their agricultural productivity, to identify and safeguard eco-friendly traditional farm practices and their associated landscape, agricultural, biodiversity and knowledge systems of the local community. This is the correct answer. Third was to provide geographical indication status to all the varieties of agricultural produce in identified GIH. So this is the answer. FAO accords status of globally important agricultural heritage system to identify, safeguard eco-friendly traditional farm practices. Okay, and there was also a mains question. Effective management of land and water resources will drastically reduce the human miseries. Explain. This was a question that appeared in 2016. Now, let us discuss. India has eliminated trachoma as a public health problem. What is trachoma and how did we achieve this? Let us discuss this. Now, the WHO has recently commended India, and we also celebrated this fact, that trachoma as a public health problem has been eliminated in India, and India has become the third country in Southeast Asia to achieve this milestone. Trachoma is an eye infection, and with its elimination, India has achieved a significant progress, significant gold standard. We have called now the gold tier public health status, demonstrating significant progress in health care. Now, what is trachoma? Now, trachoma is an eye infection. It is caused by a bacteria. Many of you must have seen conjunctivitis. It starts off as that. Now, it is an infection caused by Chlamydia bacterium. It causes an inflammation of the eyes, thickens the upper eyelid, and then what happens is the eyelashes are turned inwards. Now, the eyelashes, what they start doing is they start scratching against the eyeball, and eventually over a period of time, they destroy the cornea, and this leads to a kind of blindness that cannot be repaired. You cannot regain sight once you lose it to trachoma. Now, how is it? What are the symptoms of this? We have mild itching and irritation of the eyes, mucus and pus discharge, eyelids are swelling, the swelling of the eyelids, there is light sensitivity and eye pain. What are the risk factors? Poverty is primarily a disease of the extremely poor because of the conditions in which they live. Poor sanitation, crowded conditions. Now, it's caused by Chlamydia trachomatis. That's a bacteria that causes it. And it spreads through personal contact, clothes, bedding, or by flies that have been in contact with the discharge from the eye or the nose. Now, this is a public health problem in 38 countries. Okay. It's a public health problem in 38 countries and is responsible for the blindness of about 1.9 million people. Permanent blindness. And based on April 2024 data, 103 million people live in trachoma endemic areas, which is that they're exposed to the possibility of trachoma. They are exposed to the possibility of blindness. Now, in 2023, 130,746 people received surgical treatment for advanced stage disease, and 32.9 million people were treated with antibiotics for this. And Australia is the only developed country that suffers from this problem, that has blinding trachoma. And in the case of Australia, it's the only developed country that has trachoma. And in the case of Australia, it's among their aboriginal populations actually. Now, like I said, first the infection is on the inside of the eyelid, they thicken, then there is scarring of the eyelid, pulls the eyelashes into the eye, and then the eyelashes scratch the cornea, and the eye you go blind after that. Now, what is the incubation period? How does it affect people? Let us look at this. Then, how is it to be treated? We'll see some more details. Incubation period is generally between 5 to 10 days. But most of the episodes of infection are reinfections, and it's not a one-time thing. Only when people are affected over and over and over a period of time due to trachoma do they go blind, which is where actually the poor populations of, which is where actually extremely poor people go blind because of this infection. Now, between 2 to 3 months, a person can infect others. In its early stage, it's extremely infectious. And what's the treatment for trachoma? It's a single dose of antibiotic called azithromycin. It's a fairly easily available antibiotic. And it's a recommended treatment. It's a single shot treatment that generally cures it. Now, what the WHO has said is that there is a standard called SAFE. The WHO has said, how do we handle this problem? It is called the SAFE method, SAFE. First is surgery. People are surgically, they try to remove the eyelashes from scratching the eye, from scratching the eyeball. Then there are antibiotics. Then there is facial cleanliness and environmental improvement. So, together with these 4 methods is how trachoma has been eliminated in our country. Now, what are the risk factors? They're called the 6 Ds. These are the kind of things that end up in prelims generally. There's dry, dusty, dirty, dung, discharge, and density. All these are considered risk factors. So, how did the government achieve this appreciable goal of actually eliminating trachoma from the country? The government basically put in a system in place over a period of time, and we worked for decades actually for eliminating this disease. We had the National Trachoma Control Program in 1963, which was later integrated into our National Program for Control of Blindness, NPCB, and in 1971, blindness due to trachoma was 5%, and due to various factors, now it's come down below 1%. Like I said, the SAFE strategy was implemented across the country. As a result, in 2017, India was declared free from infective trachoma. However, whenever an infection is cleared out and we know that there are no more cases in the country, what the government typically does is we go into a period of surveillance. We did this, especially any infectious disease, we generally don't declare that, okay, nobody has an infection. We go into a surveillance period. So, between 2019 and 2024 was there where we had a surveillance period, and where there was the trachoma districts were actually very intensely studied to ensure that to see that there is no trachoma anywhere. Also, we had programs like Swachh Bharat and Jal Jeevan Mission. They played a vital role. Now, after that, after the survey period, we have what is called the validation and elimination. Now, in 2024, we have finally said that in 2021 to 24, across 200 endemic districts, we said that we carried out the surveillance and said that there is now no longer any trachoma in the country. So basically, it took years and years of efforts to eliminate an infection like this. It wasn't an overnight thing. And right now, we can safely say that trachoma is eliminated from the country, and there are no people will not be losing their eyesight due to a horrific disease like this, because it was irreversible. Once the eye is completely damaged, there was no way sight could be restored to anybody. But now the country is free of this. Let us discuss Deen Dayal Antyodaya Yojana, National Urban Livelihoods Mission 2.0. Now, the government will soon roll out the new version of NULM. It's called the NULM 2.0, and it will focus on 6 groups: construction workers, gig workers, waste management workers, care workers, domestic workers, and transportation workers. What is the NULM 2.0? NULM was launched by the Ministry of Housing and Urban Development in 2013. This was basic, and the existing Swarna Jayanti Sahar Rozgar Yojana was basically changed into, it was renamed in 2016, and it's now called the Day NULM project. It basically focuses on organizing the urban poor in their, and to ensure strong grassroots level institutions to ensure that their livelihoods are on a more sustainable basis. So one of the things we have been doing is creating SHGs, self-help groups. So basically we have, this is a grassroots level oriented program, and we try to create opportunities of skill development leading to market-based employment, and we help them to set up self-employment ventures. So basically the mission also aims at providing shelter equipped with essential services. So it addresses issues like suitable spaces, institutional credit, and social security and skills for the deprived. It's basically an urban program addressing the urban poor to ensure that they have a livelihood, and it's on a sustainable basis, and that this livelihood, in case it's not possible, we ensure that we give them skills for gaining the livelihood possibilities and help them organize. We help them we give them credit, and we also create ensure that there are market linkages. So this is what is the heart of this program. Now, what has been the implementation and of this program? Primary target, like I said, is the urban poor, including urban homeless. Now, it was implemented in all district headquarters and all towns, irrespective of the population, basically, and in other towns with population of at least 1 lakh as per the 2011 census. Now, at present, 790 cities are under NULM, and some towns, if the state requests on an exceptional basis, they can be included in this list. Funding, basically, it's a center-state project in the 75:25 ratio. And for northeastern states and special category states, it will be 90:10. So 90% will come from the center, 10% will come from the state. In the case of other states, it will be 75% from the center, 25% from the state. How are the performances? Under the mission, more than 89.33 lakh women have been brought under self-help groups. 6.12 lakh SHGs have been provided with a revolving fund of 10,000 each to get started. And skill and employment have been provided by about 15 lakh people have been benefited from this. In addition, 8.83 lakh beneficiaries have been assisted to set up their own businesses. Street vendors, the mission has conducted surveys to identify their numbers in 3,467 cities. A total of 53.76 lakh vendors have been identified, and they have been given identity cards, and 37.52 lakh vendors have been given certificates and issued identity cards. What the government will do basically is, will ensure microcredit up to 4 lakhs in the case of an individual, and 20 lakhs. If it's a individual, can be given about 4 lakhs, and if it's a group, they can be given 20 lakhs respectively. Under this scheme, they can be provided loan, and this credit will be at the subsidized interest rate of 5%. Now, this will help in starting enterprises. It will help in creating social infrastructure, and in providing innovation grants such as buying sanitation machines and things like that. Let us look at the previous year questions. Empowering women is the key to controlling population growth. Discuss. This was a question in 2019. Discuss the positive and negative effects of globalization on women in India. Male membership needs to be encouraged in order to make women's organization free from gender bias. Comment. So these are areas that are related to the issue we discussed, and questions need not be straight from that, but you can always draw the material from one idea and use it in another. NITI Aayog report on future pandemic preparedness. Corona has been a massive wake-up call, and NITI Aayog recently has come out with a report about what to do how to be prepared for the future, what we need to do, and let us discuss this report. Now, after the pandemic ended, what the government realized and the world realized is that this is not going to be the last pandemic, because in fact now there is a growing fear among the scientists of the world that we may be entering an age of pandemics because of climate change. Now, because of that, because of ideas like that, the NITI Aayog has released an expert group report on the future pandemic preparedness, emergency responses, a framework for action. So this discussion is going to be about this report. Now, WHO has warned that 75% of future public healthcare threats are likely to come from pandemics, or rather zoonotic threats, what we just discussed, which could be due to emerging, re-emerging, and new pathogens. We discussed what are zoonotic threats. They're basically threats that they're basically diseases that come from animals to human beings. The disease reservoir could be in animals, the pathogens reservoir could be in animals, and then they cross over, and humans are infected from that. In June 2023, NITI Aayog, recognizing the likelihood of future pandemics, created a expert group on planetary ecology, climate, and human animal dynamics, and constituted an expert group. This expert group was supposed to provide a framework for future action, and that is what they have done. Its key was to analyze how COVID was managed both nationally and globally, and to come up with a framework about how well are we prepared to handle this situation in the future. What are the key recommendations of the report? Public Health Emergency Management Act. They first said that we need a Public Health Emergency Management Act, that the current legal systems are not equipped to deal with any pandemic-like situation. Report highlights the limitations of the existing legal frameworks and says that the Epidemics Disease Act, which is from 1897, it's actually more than 100 years old, and the National Disaster Management Act of 2005, both are not adequate to meet the response that is required to come out with a correct response in the face of an epidemic or a pandemic. Now, the EDA lacks the definition for terms like dangerous or infectious. That is because it's from 1897, and doesn't address processes for drug distribution, vaccines, quarantines, or preventive measures. So it's grossly inadequate. Similarly, the NDMA, the National Disaster Management Act, was basically created with the idea of meeting the needs of natural disasters. So nowhere in the framework have we envisioned a situation where the country could be brought to a standstill due to a pandemic. So the first thing the NITI Aayog has said is, let us have a Public Health Emergency Management Act which will take care of this issue. Then the law should empower central and state governments to respond effectively to pandemics and other health emergencies, and would equip public health agencies with urgent action powers to create trained public health cadres at national and at local levels. And they also have said we need to have empowered panel of secretaries headed by the Cabinet Secretary in Public Health Emergency Preparedness, so that they have a system in place to meet a pandemic-like situation. Now, this group, what they would do is basically operate during non-crisis periods, and they would strengthen government finance, research and development, surveillance and partnership, whereby we'll ensure that there will be a rapid response in the face of a pandemic. EGOS will also create standard operating procedures for handling pandemic situations and setting up subcommittees to manage these key areas effectively. And that will ensure that the nation is better prepared for future situations. Now, the other thing they have said is strengthen surveillance. The report emphasizes the need to strengthen India's disease surveillance, particularly in the light of emerging pandemics and epidemics. And the key recommendations include setting up biosecurity and biosafety networks across the country, so which we don't have right now. These would connect leading research institutes, which would help in biosafety containment. There should be labs and genome sequencing of centers. Now, if you remember, during Corona, one of the first things we needed was a sequencing of the viruses, and that could not be done quickly enough, at least in our country, and that was a major breakthrough. So, for the future years, the NITI Aayog suggested that all that was needed should be already in place. The system should operate in a coordinated and automated manner, and should have swiftly, if there is any health threat that is coming, they should quickly identify it and then act on it. The proposes that we should have an emergency vaccine bank. For example, recently we had an outbreak of Mpox. We have discussed this recently. In one of the previous episodes, we discussed Mpox, and there is no vaccine for Mpox. So what was needed was, we needed a smallpox vaccine, and this is not available anywhere. So there were 4 countries that had smallpox vaccine, and we had to import it from them. And those who have already gotten smallpox vaccines, they were okay with it. So things like that. You need to have emergency vaccine banks which can quickly respond to, so that domestically or internationally we can have rapid access to vaccines. If you remember, during the pandemic, we very quickly were able to overcome a lot of existing legislations, existing bottlenecks, and we were able to procure vaccines. And the biggest advantage for us as a country is we are the world's largest vaccine manufacturer. So this should be easy to do for us. Now, the other thing they have said is there should be a network for early warning. We need to create an epidemiology forecasting and modeling network to predict the transmission dynamics of infectious diseases. And we need to have effective countermeasures like vaccines. Also calls for network of centers of excellence across the country which research priority pathogens. We already have a list of pathogens for which we don't have vaccines. They would work on diagnostics, therapeutic and vaccines, the COEs, and there'd be priority pathogens identified by WHO. So this would be an early network for early warning. Then the NITI Aayog has also suggested an independent drug regulator, that India needs to establish a robust clinical trial and network recognized by international bodies so that innovative medicines could be brought out much more faster. Highlights the importance of making the Center Drug Standards Organization an independent body. Right now it is not an independent body, and currently the CDSCO is responsible for regulating drug import, sale, distribution, and operates under the Ministry of Health. What the NITI Aayog suggested is that let it operate as an independent body instead of as a department or a division of another ministry. There are other recommendations that they've come up with. They've said a 100-day preparation strategy. It emphasizes a rapid response system where everything would be operational within a span of 100 days. Then they also have suggested expanding public health workforce, and that we need to have a robust supply chain resilience, and that we need to have digital infrastructure and data sharing. Now, data sharing is something that was also brought up in the G20 summit, and the NITI Aayog paper is actually taking forward that idea. So, this is what the NITI Aayog has actually suggested, that whatever was needed during the corona pandemic will be needed again in case there is another pandemic or an epidemic. So, it's necessary that we have all those systems in place instead of again going through the same bottlenecks. Thank you very much.